When you wake up with a red eye, probably your first question is, why in the world do I have a red eye? And the second question is, how can I get rid of it? Well, in today's video, we're gonna go over exactly that. I'm gonna give you the most thorough assessment I can of what might be causing your red eye, and we'll talk about ways to make it better. All that and more in today's video. Welcome to iSchool with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week. Hi, I'm Dr. D. I'm a doctor of optometry with my own private practice. I'm residency trained in ocular disease and I specialize in dry eye. And on this channel, I post videos about educational eye health and vision products. So if you like that sort of thing, please consider subscribing down below. All right, pupils, it is time for iSchool. So today's lesson is all about red eyes, and certainly having a red eye is no fun, but it happens to all of us from time to time. Something important to remember is that a red eye, or what most people will call it pink eye, is not a diagnosis itself. That is merely a symptom. So saying I have pink eye is pretty non-specific. Most people mean conjunctivitis when they talk about pink eye, but there are many, many other causes of a red eye or a pink eye that could be happening that aren't just a simple bacterial or viral conjunctivitis. All right, so as a doctor, when I'm looking at a pink eye or a red eye, I'm trying to find the root cause. So most any red eye, you could argue that there's inflammation happening there, but I'm really looking for what is the thing that caused this redness. And those root causes, very generally speaking, I've got it kind of divided into 4 different major groups. So the first is inflammation. The root cause here is inflammation. Inflamed tissue, the inflammatory process has been triggered for one reason or another. The second sort of column of things to think about are infectious causes. Now there are many infectious agents, right? You could be talking about bacterial, viral, fungal, but having an infection root cause is a little different than having an inflammation root cause. I'm getting a little, okay. The next thing to think about is our root cause maybe trauma, like a foreign body or something traumatic that happened to the eye. And the final, I would kind of throw into the mechanical / miscellaneous realm. These are things that happened because of a mechanical reason, potentially with the lids or another piece of the ocular anatomy, and don't quite fit into those other categories. So let's first go over that inflammation category. Within the inflammation category, there's a number of different things that can cause an ocular inflammation. The first thing that comes to mind that would cause a pink or red eye is episcleritis. Episcleritis is an inflammation of the episcleral tissue, so it's a little more anterior on the white part of the eye. Episcleritis can happen just randomly, what we call idiopathic, or just kind of no reason for it. And in some cases can be associated with other systemic diseases or inflammatory conditions. Another one is scleritis. Scleritis is a little more serious, much more often associated with a systemic inflammatory disease, autoimmune diseases, for instance, like rheumatoid arthritis. And scleritis is an inflammation down deeper in the tissue, in the sclera of the eye, so that thicker, more fibrous, deeper part of the white part of your eye. Both of those things would cause a pink eye, one with some pain, scleritis, and episcleritis with more of an irritation. However, each of those are a pink eye. That's not a conjunctivitis. The next is seasonal allergies. Seasonal allergies happen because of exposure to an allergen, and then the ocular tissues become inflamed. The appearance with seasonal allergies is usually very full of fluid. The white part of the eye can retain fluid. There's a specific reaction that occurs on the underside of the lids called a papillary reaction, but basically you're just seeing inflammation throughout. Another inflammatory condition can be caused by contact lens wear or contact lens overwear. That's called giant papillary conjunctivitis. Now, I made a whole video about GPC and how it's one of the main things that kind of forces me to take patients out of contact lenses, whether it be for short-term or long-term, and I'll link that video above. But GPC occurs as a response to a contact lens being in the surface of the eye for too long and the upper lid sort of having a shearing effect, interacting with that contact lens throughout many minutes, hours, days, weeks, and even months. And you can have an inflammatory reaction occur up under the eyelid. The next inflammatory condition that can cause pink eye is dry eye syndrome, which I've made a million videos about since I'm a dry eye specialist. So we'll make sure to link all of those in the description below. Dry eye syndrome occurs, it's an inflammatory cascade, it's chronic, it's progressive, and dry eye is an inflammation of all of the tissues of the front surface of the eye. So again, dry eye, your pink eye could be, if it's chronic and low grade and has been coming on slowly, it's possible dry eye could be the cause. Next, in the inflammatory section, we have anterior uveitis. So anterior uveitis occurs when you have inflammation within the anterior chamber of the eye. So taking a look at our eye model here, we're talking about this area between the iris and the cornea itself. So within that space, we have a chamber. It's called the anterior chamber right in here. And the iris can become inflamed and you can have inflammation within the anterior chamber. Anterior uveitis will cause a red eye, but it's usually what we call circumlimbal. So the limbus is where the cornea and the conjunctiva come together. And circumcorneal flush or circumlimbal flush is when you have redness and inflammation most densely around the cornea, just like this. So if you have redness that's really just around the entire rim of the eye, that could be pointing to an inflammation within the anterior chamber itself. All right, so that is not a conclusive list of every inflammatory situation that can arise with the eyes, but it certainly, scratches the surface and gives you an idea that there's certainly a lot of inflammatory causes. So let's move on to infectious causes. Infections, most people know what those are, but infections can be the common one, what people call pink eye, conjunctivitis. So we can have a bacterial conjunctivitis, a viral conjunctivitis that often occurs after you've had a virus and upper respiratory infection. The end. Kicking off our infectious reasons to have a red eye or a pink eye, we're going to just start with the lowest hanging fruit, which are the conjunctivitises. So you can have a bacterial conjunctivitis from any bacterial pathogen, or you can have a viral conjunctivitis. And most of the time when you have pink eye or you're diagnosed with conjunctivitis, it's actually a viral conjunctivitis. Another possible infectious reason to have a red eye is a corneal ulcer. Now, corneal ulcers most commonly happen, I would say, in contact lens wearers. So if you've overworn your contacts, you could have a corneal ulcer that becomes infected and now you have a red eye. That is most commonly true, but you can certainly get a corneal ulcer otherwise. Let's say you had an injury of some kind and it becomes infected. It's just possible to have another type of infectious ulcer without wearing contact lenses. You can have fungal ulcers, bacterial ulcers, and even viral. So it's just very important to get checked out if you have an ulcer. Our final type of infectious problem that would be causing a red eye is an infection from herpes simplex or herpes zoster. So these are viral agents, of course, and I group them with the infectious category, but a red eye can certainly be caused from a reactivation of latent herpes simplex or having shingles, particularly if it occurs on the face. You have those vesicles forming on your forehead, and then the most critical with shingles is if it's on the tip of your nose. That's called Hutchinson sign, and it's very likely that you'll have ocular involvement if that's the case. So to recap, infectious, we have run-of-the-mill conjunctivitis that everybody's heard of, we've got corneal ulcers, and we've got herpes simplex and zoster. Moving on to trauma. So when I'm looking at a red eye, I'm also looking for foreign bodies, corneal abrasion. So the first thing is a corneal abrasion. Did you get a scratch from a baby fingernail or a tree branch or something else, a Nerf ball? Any of those can cause a corneal abrasion, and those are very painful and they cause the eye to become red. The next thing is a recurrent corneal erosion. Recurrent corneal erosions seemingly happen for no apparent reason. You can wake up in the morning, open your eyes, and your eye hurts and is painful. They're most common if you have some underlying corneal dystrophy or if you've had a corneal abrasion in the past, even if it was many years ago. This can put you at a higher risk of recurrent corneal erosion. Next, we have a foreign body. So foreign bodies can be anything. I have pulled fiberglass out of people's eyes, metal, many pieces of metal. My dad, one time, he was a pig farmer and he got a piece of a pig's tooth in his eye. So foreign bodies can literally be anything, and you really have to examine as the eye doctor to make sure they're not only in the cornea, the conjunctiva that you can see, but looking up under the lid within the fornices of the eye and just really looking for foreign bodies. But a foreign body will certainly cause irritation and redness and might be mistaken for pink eye. Another traumatic thing that can happen is a hyphema. So hyphema occurs when the eye has undergone a pretty great force, right? So this doesn't occur all the time. In practice, I've seen this when a bullwhip snapped back and hit one of my patients directly in the eye. What happened was a vessel in the iris burst, and so you have blood within, again, that anterior chamber of the eye, this section between the iris and the back of the cornea. That's a very serious injury and needs to be treated right away because often the pressure of the eye will be high and that needs to be addressed right away so you don't develop glaucoma. All right, so those are the traumatic reasons you could have a red eye. But of course, if you haven't had anything like that happen, it's unlikely that trauma was the reason for your red eye. The final category would be those mechanical causes or sort of miscellaneous. We'll just lump them in at the end. And a couple of things to consider there. Number one is an acute angle closure. So this is, again, something that thankfully doesn't happen all that often. I talked about it in my pupil dilation video that I did a couple months back. But within the course of normal vision, your eye is continually adjusting your iris via the pupil to let more or less light in. When an angle closure occurs, it's typically because the iris, as it dilates, blocks this drainage angle right here in the periphery of the anterior aspect of the eye. So everybody's eye has to be able to regulate its own pressure and drain basically the fluid within the eye, right? Continually regulating the pressure. And so mechanically, if the iris is dilated and it goes into that angle where drainage is occurring, it can block off that angle, skyrocketing the pressure. I have seen this. I've seen it in chronic angle closure, so it's possible in the right or wrong scenario, right? So if you have a really short eye and you have a cataract forming, sometimes it can push that angle closed chronically, just long term. I've also had this happen to a patient who had knee surgery and had a scopolamine patch behind the ear for a course of like 2 or 3 weeks. Again, perfect scenario, just all the wrong factors combined, but this particular patient had her own natural lens still, so she had a big, thick lens in here, a short eye because she was farsighted, and then with the combination of that scopolamine patch, moving the iris into the angle, it actually closed her angle. And when I saw the patient, the pressure was in the 70s. So I have a pressure video that tells you normal pressure is normally between 10 and 21. So acute angle closure causes a red eye because the eye is in great distress, right? So you have a cloudy cornea, bad vision, very red eye, very painful, and the pressure can go up into the 70s, which is very, very painful to have happen acutely. So that's one thing mechanically that can happen that would cause a usually unilateral red eye. It would be pretty rare to have both close at once, but it's possible. You could also have, sort of switching gears, a subconjunctival hemorrhage. These are actually really super common. A subconj hemorrhage is a rupture of one of the little capillaries within the white part of the eye, and when that ruptures, the blood spreads out. These notoriously look worse than they are. They can happen from vomiting, from sneezing too hard or coughing too hard. They're more common if you're on blood thinners or if you do a lot of Valsalva maneuvers like lifting weights and holding your breath and really squeezing. You can pop a blood vessel in your eye that leads to this subconj heme and therefore a super red eye. And finally, one other thought is you can have a basement membrane dystrophy or Fuchs dystrophy or one of the other dystrophies that causes a compromise in your cornea and then makes your eye become red. So my goal with this video was to show you all of the possibilities out there that your optometrist or ophthalmologist is thinking about when they are looking at your red eye and using the signs they see to come up with their differential diagnosis and ultimately the true diagnosis in your condition. All right, today's lesson was all about red eyes, and in searching for this video idea, I did a lot of research looking up like, why do I have red eyes? And unfortunately, I feel like a lot of those lists sometimes can be really too short, and my goal wasn't to overwhelm you, but to just kind of give you a sense of what we're thinking through as we're examining pink eyes. Ultimately, I feel that it's very, very important to see your eye doctor about red eyes because it's not always so simple as one or two or even three things. You may be completely surprised that your red eye is actually due to a systemic illness, an autoimmune disease. Your eye doctor can actually diagnose that, which is amazing. And it's also just so important to get pink eyes checked out for that reason. Honestly, when it comes down to it, there's no tips I can give you that I feel good about on this YouTube channel to take care of a red eye, right? Like, there are so many things it could be that my best advice to give you is definitely get it checked out. Don't wait on a red eye because there are certain situations where getting it treated quicker can not only diagnose like a systemic illness, but really ensure that you won't lose vision. All right, guys, that is going to be it for today. I want to thank you for joining me. If you haven't already, make sure to hit that like and subscribe button down below. Start a conversation in the comments. I love to hear from you guys, and I will see you next time.